The moment a woman pops an emergency pill, what happens in her body?
That pill has a high dose of progesterone that increases your progesterone level in the body. यूट्रस की लाइनिंग को आउट ऑफ सिंक कर देता है. Makes you feel nauseous, bloating, spotting, cycles go for a toss. And the most important thing, it has a high failure rate. काफी सारे young girls,
What is that age group?
18 to 25,
We go through hormonal changes throughout our lives. All these kind of pills, if we have taken them throughout our lives, there are some external hormones only. What are the kind of long-term side effects?
trauma that girl goes through, it's another level. So it can go right from guilt to hatred towards your partner to hatred towards yourself. They just dislike the whole idea of being sexually active, getting intimate, because what if I get pregnant again? In India, talking about sex and contraception is still a taboo, and contraception is the need of the hour.
Many believe emergency pill can be used as a plan B every weekend medically. Is it safe? Today we have with us Dr. Suruchi Desai, Director of High Risk Obstetrics and Senior Consultant at Nanavati Max Super Speciality Hospital, Mumbai. She has over 25 years of experience and has delivered more than 2,000 babies, many of them high-risk cases with remarkable outcome. She was among the first in Mumbai to deliver a COVID-positive mother at Nanavati Max. She continued her work fearlessly through all three ways. She has been featured among India Today's top 25 doctors in Mumbai. She is also a robotic surgery expert and a lifelong learner. ISP certified in women's leadership and healthcare management, Dr. Desai continues to combine science, compassion, and innovation to redefine women's healthcare. So, doctor, emergency pill. So the question is, the moment a woman pops an emergency pill, what happens in her body?
Please understand, it is called emergency pill. Means it is not your baseline pill. It is not your baseline contraception. When your baseline contraception fails, कि आपका कॉन्डम फट गया है, कि आप भूल गए थे, या फिर आप कॉन्ट्रासेप्टिव पिल्स पे थे 21 दिन वाली और आप भूल गए हो, you are traveling, or it was completely an unplanned relationship that happened, then you have to use it. Okay? That pill has a high dose of progesterone. I'm sure आपको पता है हमारे body में estrogen, progesterone, and very little of testosterone is there.
Yes.
So when you pop in a pill, emergency pill, in the Western country we call it as the night after pill also.
Yeah.
So that increases your progesterone level in the body. यूट्रस की लाइनिंग को आउट ऑफ सिंक कर देता है. थैली के मुंह सर्विक्स पे चेंजेस करता है तो वहाँ पे जो डिस्चार्ज होता है म्यूकस उसको थोड़ा अलग कर देता है. So the whole idea is that you do not want to have an unplanned pregnancy, and that is why you are using this emergency contraception. So that is why it is going to put your body out of sync of the 28-day or the 35-day cycle of your periods. First thing मुझे यहाँ पे बताना बहुत ज़रूरी है, it is not a foolproof technique to prevent an unplanned pregnancy. It has a high failure rate, and it is not the same like your 21 days contraceptive pill. And I have young girls telling me, doctor, why are you giving me 21 days pill?
What is the difference between the two pill and
Exactly,
how
I'm
do they
coming
function
to that.
differently? Yeah.
Yes, so the 21 days contraceptive pill is a very low dose tablet pill which has your estrogen and progesterone both, and it is given in a very low dose. We start typically on the second or the third day of your periods. You take it every day at a fixed time for 21 days. When you stop it within 3 to 5 or maximum 7 days, you will get your period. It is a external hormone taken in a very low dose, makes your lining very thin and does not let your ovary release an egg. The ovulation part does not come.
Okay.
तो जब एग ही नहीं है और भले स्पर्म्स आ गए बॉडी में, फर्टिलाइजेशन होगा ही नहीं.
Okay.
They cannot be a pregnancy. So when we are talking about contraception and its failure, we talk about Pearl index. That is how we measure.
Can you just explain it for the for layman, मतलब Pearl index.
Pearl
हाँ,
index is कि what is the failure rate of the contraception, उसको Pearl index बोलते हैं. तो contraceptive pills have the lowest failure rate.
okay.
Okay, because egg ही नहीं है, तो
correct.
प्रेगनेंसी कहाँ से होगी? अगर कॉन्ट्रासेप्टिव पिल पे है कोई औरत और फिर भी वो प्रेग्नेंट हुई, तो या फिर उसने बराबर से दवाई नहीं ली है, उसने लेट चालू की है इन हर साइकिल, तो ऑलरेडी ओव्यूलेशन हो गया था, या फिर शी मिस्ड अ लॉट ऑफ डोजेस, और शी हैड सम लूज मोशंस और वॉमिटिंग, एंड दैट इज व्हाई द पिल केम आउट एंड शी डिडंट रियलाइज.
Yeah.
So this is a more structured way of contraception.
Okay.
Now when we talk about emergency pill, it is emergency.
I was just coming to that question only.
Yes.
कि nowadays this emergency pill is being popped like every time you are planning
It's
to
like
have.
everyday pill.
Yeah, it's on.
So please understand, it has only progesterone. Your contraceptive pills, when we say COC, that is combined oral contraceptive, it has estrogen plus progesterone. We have only progesterone pills also for contraception. We give it to women who cannot be given estrogen and who have some medical disorders. But understand, they are all taken for 21, 24, 28 days. तुम महीने में 2 बार या एक दिन में 4 बार गोली ले लेते हो, वो सेम नहीं होता है ना. हर रोज आप खाना खाते हो ना.
करेक्ट.
कि आपने बस आज खाना खा लिया तो अभी नेक्स्ट 20 डेज में कुछ नहीं खाऊंगी. तो ये है कि आपका फेलियर अनप्लान्ड रिलेशन में जो एग और स्पर्म के मिलने की चांसेस है, फर्टिलाइजेशन का चांसेस है, दिस इज सपोज टू ब्रेक दैट. इट विल नॉट लेट द फर्टिलाइज्ड एग इम्प्लांट गेट इन स्टिक टू द यूट्रस एंड स्टार्ट ग्रोइंग. और many a times girls will come and say, women will come and say कि डॉक्टर मेरे को 15 दिन में वापस पीरियड आ गया, और आई एम ब्लीडिंग और स्पॉटिंग एवरी डे. एंड जब हम हिस्ट्री पूछते तो पता चलता है कि उन्होंने एक इमरजेंसी पिल खाई थी एंड द साइकिल हैज गॉन आउट ऑफ सिंक. काफ़ी सारे young girls, I will specifically say young girls.
What is that age group you're talking about when you say younger?
18 to 25.
Wow.
In India, anything below 18 is not allowed because otherwise it is a forceful act and it causes a different thing altogether. Let's not talk about it. But our law allows a girl to get sexually active only after she's 18 years. Compared to the Western counterparts, where at 12, 15 is when they do get active. So there, in the Western countries, once the girls are in high school, they are put on contraceptive pills for multiple reasons, because they are sexually active. Suppose she is a teen and gets pregnant and she chooses to continue the pregnancy, the healthcare pe burden aa jata hai because the government is paying for everything. So there, by default, they counsel and these girls are put on contraceptive pills. The mother or the father or the girl herself will go to the gynaec and understand and go on the pill. In India, talking about sex and contraception is still a taboo. ट्रूजो में माँ बहुत सारी चीज़ें देंगी, बट एक सिंपल गायनेक विजिट नहीं देते आज भी, विच इज़ अ वेरी सैड सिचुएशन. Most of the time the girl comes on her own because some friend has come to me or they have read somewhere about something and they want to educate themselves. And I really appreciate that they are making time to understand their body, because if they are not taught, they don't know what is happening to them. And jab there is a lot of print advertisement or TV advertisement about specific emergency pills, they think this is the way forward. And this is very safe because it's coming on national television. So emergency pill is just going to disrupt your menstrual cycle, so the pregnancy does not grow or the fertilization doesn't happen.
What are the kind of long-term side effects?
The system goes for a toss. इट इज़, मैं आपको सिंपल सी बात समझाऊँ, हमारे बॉडी का सिकार्डियन रिज्म है. हम सुबह उठते हैं, सनलाइट देखते हैं, खाना वगैरह खाते हैं, दोपहर सनसेट के बाद हम आइडियली खाना कम कर देते, सो जाते. बिकॉज ऑफ योर जॉब यू हैव नाइट ड्यूटीज. आपकी सिस्टम को क्या होता है,
सारा उलट पुलट हो जाएगा.
Exactly. You start having acidity, bloating, नींद नहीं आती है, गलत टाइम पे नींद आती है. तो जब आप ऐसे एक पिल लोगे जो आपके सिस्टम को it's in a beneficial way doesn't let you get pregnant, but it is going to harm you.
Yeah.
And please understand, for every unprotected act, every single coitus, we call it in medical language, you need to take one emergency pill. And it has to be taken within 72 hours of the act. And because it is a high dose of progesterone, it makes you feel nauseous, bloating, spotting, cycles go for a toss. And the most important thing, the girl or the lady may still get pregnant and she will not know that she's pregnant.
Does it also affect your fertility rate somehow?
You're abusing your body, no?
Yeah.
So कुछ तो होगा ना. Your ovaries will go for a toss. There'll be a lot of confusion in your body. And then the cycle को वापस लाने के लिए, it is a tough job for the doctor.
Doctor, can you mention one of your case studies where you really...
The case that I completely remember was this young girl. And this again we are talking about 10, 12 years. I'm into practice for 25 years. So nothing recent, because I think girls today are much more aware. Maybe because they have access to a lot of things. She took emergency pill. And obviously she had little spotting. And she thought she's got her periods and she was scared to ask anybody. Obviously internet was not so common in those days. She didn't check. And then she didn't get her period, so she thought because of the eye pill she's not getting. And बाजू वाले को friends को पूछा, they said हाँ ये तो होता है. And when she came to me, she was already 4 months pregnant. Imagine the shock in a 20-something-year-old who is not married, and she comes to know she's 4 months pregnant. Please understand, the medical part the doctor will take care of, but the emotional trauma that girl goes through, it's another level. We don't talk about mental health. So it can go right from guilt to hatred towards your partner to hatred towards yourself.
Yeah, it can add to a trauma that will stay forever.
And
I mean, like,
sometimes they just dislike the whole idea of being sexually active, getting intimate, because what if I get pregnant again?
Yeah. It's a trauma
It's
for
an
life.
absolute trauma. And then so many patients today I have who are in their 35s and 38s, had a late marriage, will come and say, doctor, in my younger days I've had an abortion, medical. Obviously my partner knows, doesn't know, whatever it is. It's their personal life. But then when they are finding it difficult to get pregnant, they always come back and say, is it because of the thing that I did last time that I'm not getting pregnant? So it has a long standing impact. जो दवाई है उसको दवाई की तरह से रिस्पेक्ट करना है, उसको कुरमुरा चना सिंग दाल नहीं समझना है, just keep on popping it. Right? So this whole thing will reduce when the younger generation is given right sex education. When we talk of sex education, most of the mothers think that अरे आपने सिखा दिया तो मेरे बच्चे करने लगेंगे.
ये बहुत बड़ी गलतफहमी है जो
Which world are you living in?
आजकल तो YouTube और सोशल मीडिया पे एक्सेस है.
शादी होने वाली है तो this is nature. A man and a woman are going to unite. So let that union be beautiful and memorable. Why do you want it to be with a lot of trauma? And contraception is the need of the hour. But now today we will see that, I'm sure you're aware of DINKs, double income, no kids. These are the couples.
Of course. That's what's happening most of the time.
So now you have double income, pet parents, DIP. So उनको तो बच्चे चाहिए ही नहीं. They want pet parents and plant parents and whatnot is coming in.
Different kind of a parent.
So these are the couples who will need robust contraception. If in the mind the couple is sure they don't want to have a child, biological child, fair enough, we respect that. But then you need to give them some options, right? So that they don't have an unplanned pregnancy. So contraceptive need is required to any couple staying together. And these are non-negotiable things.
But doctor, one thing is there with women. We have a very complex body. We go through hormonal changes throughout our lives.
Absolutely,
You know, there is also a
absolutely.
phase when we are menopausing also.
Absolutely.
And all these kind of pills, if we have taken them throughout our lives, they definitely, there are some external hormones only which are coming into our body.
Yes, absolutely.
It cannot happen that they do not cause any kind of problem
So see,
if taken.
even a simple paracetamol is going to give you
Yes, of course.
side effect and reactions.
Yeah.
So anything खाने से अगर allergies और reactions हो सकते हैं तो ये तो chemicals हैं. So whether there are antibiotics or there are anti-inflammatory drugs or there are hormones, they are going to have this side effects. So whenever we talk about a drug or a tablet, we see the outweigh the risks and the advantage. So when I am giving you a contraceptive pill for 21 days to be taken for your contraception, I'm going to take your history, I'm going to check if you have migraines, if you are a smoker, if there's any family history of any reproductive cancer. I'll run some tests and make sure you are fine. And then give you, there are so many. So we call it as a cafeteria approach when we talk about contraception. Cafeteria approaches, I will tell the patient these are the available stuff. As a couple, what is best for you.
Okay, so you basically, जैसे वो hampers नहीं बनते हैं, so you basically have hampers for all kind of couples, all kind of.
So see, there are some couples wherein they are married but they have a long distance.
Yeah.
And they are meeting just once in 2-3 months.
Yeah.
So for them to plan when we are going to meet, sometimes it's planned, it's rampant.
Yeah.
So we need to empower them that their meeting is not stressful.
Yeah. No, absolutely. No.
So emergency contraceptive pill to all the listeners who are watching this, listening this, it is for emergency, not a daily pop-in pill. A 21 days contraceptive pill is for your regular contraception. Your gynac will know what is the best pill for you. There are lots in the market. And whatever they give, because I have a lot of mothers coming, you know, they're very rare, but yeah, few mothers who get their daughter की शादी हो रही है, आप थोड़ा सा बात कर लो, समझा लो. And then when we are talking about contraception, डॉक्टर लेकिन ये तो hormones है. तो इसे उसके hormones के साथ अगर हमको कुछ tweak करना है तो हमको उनको hormones ही देना पड़ेगा ना.
Absolutely, because they are the chemicals running our body.
आपको भूख लगी है, मैं सिर्फ आपको पानी पिलाते जाऊंगी तो after a point आप उठ के मुझे झापड़ मारोगे कि मुझे खाना भी दो ना. So exactly we have to understand. And when we are talking about contraception, it comes with a lot of data, lot of studies. So if I'm giving a contraceptive pill to a girl who has got PCOS, polycystic ovarian syndrome.
Yeah, that's also another thing.
Yes, so I will be taking care कि उनको weight loss का problem है, bloating का problem है, irregular cycle के साथ hair growth भी है, तो what do I want to treat in her? Or sometimes a couple comes, they've had their children and just want a plain contraception. So I will use something specific which is like plain vanilla ice cream, no frills attached.
Yeah.
So that is your contraceptive pills. Your emergency is different. It has only one hormone.
Yeah.
And that is progesterone.
That's why its side effects are also
Absolutely. Lot of nausea, vomiting, bloating, giddiness, fainting attacks, so many things.
So doctor, how does emergency pill work and how does a contraceptive, like a 21 days contraceptive pill work? What is the functional difference between these two pills?
So let's understand the constituent. Like I said, the 21-day pill can have an estrogen with progesterone. Typically, we are talking about estrogen plus progesterone pill. The main action of this pill, in our textbooks as we say, inhibition of ovulation. वो अंडा बनने ही नहीं देती है. वो गोली जब एक औरत रेगुलरली खाती है, irrespective of when she is having intercourse, if she is having intercourse once, twice, thrice in the whole month, she has started the pill from the second day of the period or the third day of the period, और वो हर रोज लेती है, ये साइकिल में उसको ओव्यूलेशन होगा नहीं.
Okay. So usually you start taking that pill from
the second or the third day
of your periods. Correct.
From the starting day of your period. So if you have started today your periods, कल रात से आप चालू करोगे या कल सुबह से as per your comfort. आप उसको हर रोज फिक्स टाइम पे लोगे 21 दिन तक. तो ये जो 21 दिन है उसमें आपका ओव्यूलेशन या अंडा होगा नहीं, फूटेगा नहीं, तो आप चाहे कितनी दफ़े इंटरकोर्स कर लो, प्रेगनेंसी होगी ही नहीं, क्योंकि देयर इज़ नो एग. What will the sperm fertilize? Emergency contraception has only progesterone. It will try that the egg and the sperm don't meet. It will cause changes in the environment such that even if they suppose meet, they will not go and stick to the lining of the uterus and start growing.
But that is also not 100% true.
No.
That it will happen
Emergency brake आप गाड़ी की कब लगाते हो?
जब
जब आपको
suddenly-
गाड़ी स्टॉप करनी है सिग्नल पे, आप इमरजेंसी ब्रेक नहीं लगाते, आप स्लो डाउन करके ब्रेक लगाओगे. दैट इज द डिफरेंस. आई हैव टू टॉक अबाउट दिस केस. दिस इज एटलीस्ट 15 or 17 years back in my practice that I saw. The girl, emergency contraception has been around. It is called the night after pill. It's available over the counter, and there are other ways and means. This girl would just take emergency contraception every time she had intercourse, and she had taken something like 15 tablets in a month, and she came with bleeding in the middle of the night. And how? So, you know, the thing is, they will eat right, they will want to do this diet, they will want to drink the sparkling water and the clear water and just do organic stuff and use organic sanitary napkins. But your basic thing, that what you are eating, have you even checked? Is it right for you? Have you visited a gynecologist or a general family doctor who will guide you?
Doctor, do you think the way these emergency pills are advertised nowadays, they have kind of blurred the line between emergency pill and the
Yes. Also,
21-day
we
pill?
can't just blame them. They are doing their job. They are selling their pill. We have to understand that the population is not ready to talk about it. The consumer is not understanding the normal cycle. What is emergency pill? The company which launched the emergency pill in India, they actually, when it was launched, they had a helpline number on the pack. And the consumer, the lady, the girl, whoever bought it, she could call up and check with them, and they had doctors answering it. But see, now today nobody wants to talk about it, and I think nobody wants to make a phone call if ChatGPT or AI or whatever your technology is going to answer.
They are the best friends nowadays.
Yeah, so when they come and they say, but the Google search or whatever you want to call it, the technology told me this cannot happen. I said, please go and tell the technology how to deliver you also and what is your treatment. Then why do you need a doctor? So we have to understand, take it with a pinch of salt, a big pinch of salt. It is extremely good when it is used in emergency. जैसे इमरजेंसी ब्रेक, इमरजेंसी लाइट्स इमरजेंसी में यूज करते हैं. Not every day. Exactly.
Yeah, so focus on the word emergency,
Yes.
not just what you want to.
So like I said, in the Western country they call it the pill after or the night after pill. That is how they call it. And see, they all are aware of contraception when they enter high school. यहाँ पे तो शादी के बाद तक उनको पता नहीं होता.
Absolutely, yeah.
And this we are talking about metros, so you can imagine what is happening in rural India.
So
I hope people see your platform and they learn.
So doctor, in this section we have few myths which we would like you to have your take on. So number one question is, many believe emergency pill can be used as a plan B every weekend medically. Is it safe?
No. Answer is no. You have a cycle. We call periods as cycle. It's a 21, 25, 28, 30 day cycle. In that you are bleeding, you ovulate, there is lining which thickens, there is no pregnancy, it bleeds. That is the whole cycle. It is menstruation is a Latin word which means that the womb is weeping or crying because there is no pregnancy. So every weekend you are not bleeding, or your cycle is different every weekend. So you cannot take emergency pill every weekend. No. Clear? No.
Okay. Second question is, on the other hand, a lot of people believe that using emergency pill too often can cause infertility.
You are messing with your system. Ovaries are the most sensitive organs a lady has. Just like your face will show puffiness, आपने 4 दिन सोए नहीं, आप डिहाइड्रेटेड हो, आपने अल्कोहल पिया, ओवरीज आर दैट सेंसिटिव. आपने उसको अब्यूज़ किया, वो सडनली बंद कर देगी काम करना. प्रीमेच्योर ओवेरियन इनसफिशिएंसी, प्रीमेच्योर मेनोपॉज, एनीथिंग कैन हैपन. प्लीज टेक केयर ऑफ इट.
Another big one, does regular contraception make you gain weight or make your body weak?
No. You had pills in the past which caused a lot of water retention. Now a lot of work has happened on this segment, and we have pills which do not cause water retention. So you would not technically put on weight, but there have been a lot of studies, which is an interesting part, that a lady, when she's on a contraception, when she's on a robust contraception like a pill, or she has a loop within her body, she knows that there is not going to be an unplanned unwanted pregnancy, and she enjoys her marital sexual relationship better, and with that she can put on weight because she's in a happy zone.
She's in a... What about the idea that contraception is only for married women? And how do we dismantle that idea medically?
So, anybody who is sexually active, and if the lady is not menopausal, she needs contraception. The best contraception, I tell my couples, is abstinence. दो अलग घर में रहो, there is no way you can get pregnant. None of us are Virgin Mary, none of us are Kunti who will pray and get a baby in the hand. So this is it.
Yeah. Some say my periods got delayed after the pill, so I panicked and took another one. Is that a vicious cycle?
Yes.
That
खुद के पैर पे कुल्हाड़ी नहीं पड़ी तो हम कुल्हाड़ी पे जाके गिर गए.
Wow. Are there any long-term health concerns if someone misuses emergency contraceptive pills regularly over months or years?
Yes.
This we addressed earlier also.
Yes.
Yeah. So is it true that once you've taken an emergency pill, you can't take OCP?
No.
Immediately after?
So, once that emergency contraception has been consumed in your cycle time, which part of the cycle immediately after periods you've taken, mid cycle you've taken, before your periods you've taken, उसके बाद आपको normal periods आए नहीं आए, जब आपको normal periods आए उसके बाद ही आप contraceptive pill चालू कर सकते हो.
Okay.
Yeah. So that has to be very crystal clear.
What are some less known benefits of planned contraceptive pill that people should be aware of?
It helps you in a lot of things. Your cycles become very regular. If you have very heavy periods, they go and become normal. So in the past, when women had very heavy periods and the hemoglobin dropped, they were put on pills so as to get back their hemoglobin on track along with the medications. Once you stop your contraceptive pill, within 6 months your fertility comes back. So you can plan your pregnancy accordingly. It is used for treatment of PCOS. It is used for treatment of irregular cycles. So it is a wonderful drug when it is chosen rightly and under medical supervision.
So could you list 2-3 quick facts that would surprise even someone who thinks they know contraception pill?
Today we have pills which are safe even for the biggest of smokers or women who have bleeding disorders. They are very safe. Women who are on blood thinners for stent in their body, in their brain, or for any other reasons. Today we do have pills which we can use. Again, it's not a statement that anybody can take it. Again, under medical supervision. But today there is something which medical science has got to offer. And today we have, also something we should speak is very many times patients who are around 38 to 43, 45 who are going through irregular cycles and are very uncomfortable with hormonal changes because of the perimenopause setting in. We could use pills safely for them also to get a regular cycles.
Wow. For a young woman who is scared of OCPs but casually takes emergency pill, is there a simple piece of advice you would give her?
बहन खुद की बैंड बजा रहे हो आप.
अब कुल्हाड़ी पे अपना पैर मत मारो.
Yes. आ बैल मुझे मार मत करो.
Now one last thing, if you could say one line to every young woman who takes emergency pill as a safe shortcut, what would it be?
Emergency pill, I will say once in your lifetime. That is all that you should think about it. not once every week.
Or
If you are sexually active, visit your gynae, take the right advice, and go on to a good contraception. I just hope the girls out there watching us, the younger generation, please empower yourself, educate yourself, and understand the difference between emergency pill and the contraceptive pill.
anyway, emergency is the word nobody wants in their life, so let's not have them in the pills also.
Absolutely,
Yeah,
well said.
yeah.
Thank
Let's
you.
make it slow and steady.
Yes, thank you so much.
Yeah.
Thank you.